आता बघ लाईव्ह कर आता. आता आवाज येतोय का बघ.
मोबाईल सायलेंट वर टाका.
येस आता आला ना.
मी मोबाईल सायलेंट वर टाका. हे आला का आवाज?
मी काउंट बोलतो. 1 2 3. ओके.
program on objective structured clinical evaluation organized by MBS College of Nursing in collaboration with Association of Management of Unaided Nursing College. Myself, Ms. Snell Vinzu, Clinical Instructor, MES College of Nursing, and I am delighted to be your host for this enriching session. We are gathered here today to enhance our knowledge and skills in the field of clinical evaluation through the innovative and effective approach of objective structured clinical evaluation. Before we delve into the details, let's understand why OSCE is crucial for our professional development. OSCE is a method of assessing competencies in a controlled, simulated environment, allowing healthcare professionals to demonstrate their clinical skills and decision-making abilities. Today, program is designed to provide you with insight, strategies, and the best practices to excel in OSCE scenarios. We have expert speakers and educators who will guide us through various aspects of this evaluation method. Before we proceed further, let us take a moment to acknowledge the significance of the theme. A theme serves as the heartbeat of any event, adding depth and meaning to our collective experience. I kindly request Principal Professor Nigita. Hello, sir. You are audible, sir.
What we are going to use in the nursing education, especially for the evaluation of our students. Being a faculty, teaching faculty, academician in the nursing field, we all must know what exactly OSCE means and how does this OSCE is going to help us to bring up the quality nursing student clinical examination. Objective structured clinical examinations are very helpful in medical education because they allow a student to practice and demonstrate clinical skills in a standardized medical scenario. An objective structured clinical examination is an approach to the assessment of a clinical competence in which the components are assessed in a planned or a structured way with the attention being paid to the objectivity of the examination, which is basically an organization framework consisting of a multiple stations. An objective structured clinical examination is a type of examination often used in a health sciences. It is often used in undergraduate nursing education as a means to provide standardized and objective evaluation of clinical skills required for the nurses. OSCE helps the student to better learning and master in clinical skill development. OSCE is a safe and effective teaching method to teach students clinical skills in a controlled environment under the supervision of a teacher. OSCE is first introduced in 1970s to assess the skill of a medical students. Since then, it is continuously used, especially in the nursing scenario for the nursing students. OSCEs are a form of a submission. OSCE is a form of simulation and are often summative but maybe formative also. This educational approach requires robust design based on sound pedagogy to assure practice and assessment of holistic nursing care. Core nursing skills are essential for the nursing profession. Educational strategies to help nursing students achieve these skills should be well organized for beginning of the nursing curriculum and managed as a continuing education component after graduation. The educational program should focus on the facilitation of critical and reflective thinking skills that will help the learner make rational decisions and solve problems. A way of achieving these levels of functioning is the use of assessment evaluation methods that measures the learner's clinical competence holistically. Now, when we want to implement skills in our nursing education, we as a teacher, we should know what are the advantages and disadvantages of OSCE. To sum up, few of the advantages are it is an interesting teaching method which encourages students towards active learning or participative learning. It increases the logical and critical thinking rather than passive learning. It ensures a safe, controlled environment without compromising patient safety. Students learn about tools and also develops confidence. It also increases students' knowledge and learning in more practical way. In a relaxed, supporting environment, even a nervous student can perform to his or her maximum potentials. Now, what are the disadvantages? To list down the disadvantages, it is costly in terms of resources, articles for procedure stations, and the time consuming. It requires a lot of preparation and organization of an exam. It creates competitive atmosphere and some students find it very stressful. Some students do not take OSCE seriously and would actually joke about it because, as you people are aware, these stations are quite often a student has to perform the activity alone. Many a times they feel that there is no any supervision, no any companion, no actual patients, and they are performing these kind of acts, and they feel that it is a joke. OSCE expects students to perform uniformly according to the checklist, and it does not allow for a creative and flexibility of individual students. There is no time for the students to reflect on their experiences. The scenario written on a little papers and instructions do not provide adequate information to make the decisions for the students on their own. While they still read the scenario, the bell rings for them to start the procedure. Students then act quickly like a robot or without any thinking. Before starting our workshop, I would like to request you to focus on these advantages and disadvantages. So, you have to have a proper organization. You have to work a lot for preparing the orchestrations, considering what is the psychology of our students. How do our students look at the orchestrations and how do the students are serious about these OSCE methods. I'm very much sure the validity of an OSCE is relied upon the quality of the problem posed at each station, and most importantly, the agreement of assessment checklist by means of a panel of expert opinions. Find it. A single teacher should not, I feel personally, should not just create a scenario and start asking, but how in the dissertation we are sending our tools and get it checked by the experts. Same way, even the asking checklist has to be sent to the people and get it reliability. Whether this particular checklist is a proper to assess the objectivity of that procedure. Automatic problem are encouraged to which learners are given enough time to reflect and make their own interpretation and decision. So every teacher has to consider this particular point about the time allotment, because we have to give a sufficient time, because as such there is no any standard time limit for the OSCE stations. How much time the student has to spend, it depends on particular procedure or particular task assigned in that station. So a teacher has to be sensible to provide the time limits. It is advisable rather to have less stations where learners have time to apply their own clinical vision and prioritize actions appropriately in a realistic manner than to have many stations and encourage superficial thinking actions rushing to complete the procedures. In this way, the communication skill and the affective components could be evaluated adequately. The students should advise to use the teacher as a resource person if necessary. It will reduce the nervousness and feeling of being watched. To sum up, the real power of this type of examination lies in the ability of those responsible for teaching and testing to examine their trainees with imagination and forethought in a reliable way in areas seldom or never tested before. With this, I declare that this webinar is open, and I congratulate to all organizing committee. I extend my sincere thanks to the association who has provided us this particular platform to reach to you. And definitely, I believe that you all are going to benefit and you are going to take a good note at home by listening to this particular webinar. Once again, thank you. Thank you very much.
Thank you, sir, for gracing us with your presence and for unraveling the theme that we share our journey for this session. I request all the participants to submit the feedback form after completion of all sessions. E-certificate will be generated only after submitting the feedback form and on the basis of attendance. Moving forward, let us start with the first session. I request Mr. Precision, Government Department of Medical Surgical Nursing, to shed on the topic Mastering OSCE, a comprehensive orientation, features, types, and OSCE. I request sir to initiate with the first section.
Good afternoon, one and all. Myself, Pratesh Jagam, Department of Medical Surgical Nursing from UNAIDED College of Nursing. Today I am going to deal with the topic Mastering OSCE, Orientation, Comprehensive Orientation. So in this session, we are going to take overview of features of OSCE, types of OSCE station, and uses of OSCE. Before starting the session, firstly, we will understand what is OSCE. The OSCE is The objective structured clinical examination is, is an innovative evaluation method that often used for assessing health science and nursing student clinical skills. The scheme was developed in Dundee, Scotland in the early 1970s by Dr. Hardin and colleagues. In 1975, to overcome the problems related to old-fashioned assessment strategies. So now we will see one by one. First, we will see the features of OSCE. In that, O stands for objective. In that first, uninfluenced by emotion or personal prejudice. These roles ensure that every student is graded fairly or no matters what's happening in their lives. It acts like a guardian of fairness, preventing external factors from influencing assessment. Its mission is to give each student an equal chance to at success. Next, objective critics, that is checklist. In that, objective critics follows a set of predetermined criteria to avoid personal opinions. Their evaluations are based on standardized approach, ensuring fairness in assessment. Next, students are assessed using exactly the same station or cues with the same marking scheme. Checklist act as a systemic guide for evaluation, using the same criteria and marking scheme for every student. This structured method removes a potential bias arising from variation in evaluation methods. Next, students get marks or points for each step that they perform or answer correctly. In that, by breaking down complex problems into manageable components, our approaches foster a deeper understanding of the subject. This encourages our students to approach challenges systematically, promoting comprehensive learning. So next, we'll see the structure. S stands for structure. Every student has the same patient problem, situation, and station. This means that every student encounters the same challenges during assessment. This approach eliminates potential bias, ensure that each student is evaluated under identical conditions. Next, students are required to perform the same specified task. In that, the approach promotes consistency, offering a clear benchmark for measuring each student performance. This ensures that evaluations are fair and transparent, providing a equal opportunity for success. Next is the marking for each student is structured uniformly. Every student is assessed using the same criteria, bringing uniformity to the assessment process. This establishes a fair and transparent system, fostering equal opportunity for success. Next is a where simulated questions are used, detailed scripts are provided to all students, including emotional data in the same manner. In that, educator, by providing detailed and consistent script, ensure that every student has an equal chance to show their skill and understanding of emotional nuances. This approach guarantees fairness and equal opportunity in the assessment. Next, instructions are carefully written, spoken to ensure that students are given specific tasks to complete or question to answer. In this method is crucial because it creates a clear assessment environment. Student knows exactly what's expected and clear instruction to reduce the confusion of the student, leading to a more accurate evaluation of their knowledge and skills. Next, should be carefully designed to include all elements of curriculum. Educator using a assessment ensure it aligns with learning objective, giving a comprehensive evaluation of the student understanding of the entire subject. It's about making sure the assessment reflects what students are meant to learn. Next, the stations are short. This approach let us quickly and precisely evaluate specific skill or knowledge areas. It's beneficial for both, that is, examiner and student, ensuring tasks are completed within the given time limits. Next is the stations are very highly focused. Simulations or model can be used. Simulation offers the student a real world scenario to apply their theoretical knowledge practically. This hands-on method enrich learning, adding depth to assessment, and student can show what they know in a conceptually relevant way. Next, the station, there is a reduced examiner patient input, thus increasing the validity of examination. In that, the students are assessed based on their ability to independently handle different situations. This is not only show their knowledge, but also evaluate their critical thinking and problem solving skills. Next, C. C stands for clinical. In that, first, tasks are representative of clinical situation. These assessment are like a real life test for students, checking how well they handle situation they might face in their future jobs. It's about seeing how they use what they have learned in practical scenario. Next, use to evaluate those areas most critically to perform which are otherwise impossible, the traditional clinical examination. These assessments look at practical skill, giving a complete picture of what a student can do in scenario that match their professional world. It's not just about knowing facts, it's about using the knowledge in a hands-on way. Next, the term clinical may be replaced with practical. In that, by replicating real clinical situation, students are challenged to apply their theoretical knowledge in a practical context. This not apply measure their understanding of the subject matter, but also assess their ability to think critically and make informed decision in situation. Next, we'll see the clinical or practical skill assessed. In that, first, ability to obtain or interpret data. In this evaluation, students are checked on how well they gather and understand data. It's not just about grasping basic ideas, but also about being skilled at collecting and making sense of vital information. Next, problem solving. Problem solving is a big deal in this practical skill assessment. Students real face world problem and need to use what they have learned to find solution. It's about applying knowledge to solve actual issues. Next is a communicate and handle unpredictable patient behavior. Being able to talk effectively with patient and handle unexpected situation is key for any professional. Assessing this skill ensures students can deal with human side of their jobs with empathy and confidence. Next is a history collection, physical examination and procedure that are not available or cannot perform in clinical setting. Evaluations also focus on the history collection and physical examination, crucial in many practical professions. Students must show they are good at gathering patient history and thorough exam. These skills are essential for getting diagnosis and treatment right. Next, we'll see the examination. Is designed to apply clinical and theoretical knowledge. Skills are assessed in the form of formal test of knowledge and ability. Exams are carefully crafted to check both practical and theoretical knowledge. They are like a formal challenge, pushing students to not just say what they know, but to show how well they can use that knowledge. Next, the assessment covers a broad range of clinical skills, much wider than conventional exams. This thorough approach checks a bunch of skills, making sure students are well-rounded in how they understand and use clinical concepts. It's not just about recalling facts, it's about engaging practical and emotionally with the materials. The next point is the psychomotor and affective skills are primarily assessed along with application and synthesis of knowledge. It's not a just memory test. These exams go beyond what student can remember. They want to see how student can practically and emotionally connect with what they have learned. This kind of assessment ensures that students not only know stuff but can actually use and blend their understanding in real life situations. Next point to consider. Assessment task at the consistent level is crucial for fair and accurate evaluation. This ensures students are not facing tasks that are too easy or too difficult, allowing for a balance of assessment of their abilities. Next, the clinical experience. The assessment should match the student clinical experience and academic stage. This calibration is key for realistic and constructive evaluation, providing fair chance for students to showcase their what they know and what can do. Next, fair opportunity for showcase. The expected performance level gives students a fair chance to display their knowledge and skill. If text tasks are too simple, they might not truly reflect the student proficiency. Next, we'll see the scope of OSCE. Candidates are observed and evaluated as they go through a series of stations in which they're in that first interview skill. This part checks how well candidates can express themselves, handle questions, and communicate effectively in various situations. It's about seeing how they perform in different scenarios. Next, we are examining skill. Candidates show they can assess information, diagnose problems, and make smart decisions under pressure. This station makes sure candidates have a practical skill needed for success in their chosen field. Now, let us focus on the showcasing hands-on abilities, that is, performance of procedure. Candidates don't just talk about what they know, they demonstrate how they can practically apply their skills. This part gives insight into their technical know-how and their ability to get things done accurately. Next is observation, application, and communication. In this assessment, we have observation and application station. This check candidates' ability to keenly observe a situation, analyze information, and apply their knowledge effectively. It's a dynamic evaluation ensuring candidates are not just knowledgeable but can also turn that knowledge into practical solution. Next, types of OSCE station. In that, 5 stations are there. First is a couplet station, second is a response station, third is a communication station, fourth one skill station, and fifth one rest station. So we'll see one by one, starting with couplet station. This method understands that some skills are best assessed when coupled or linked. For example, a CPR procedure, it's not just about knowing each part. It's about seamlessly combining action like compression and rescue breath, testing both understanding and integration. Second, response testing. Now, here we are testing a student cognitive abilities. It's not just about knowing things, it's about critical thinking and effective communication. This station dives into how well student can apply their knowledge. Moving to communication station. Effective communication is a key in many professions. For example, instructing student to guide a mother on using oral rehydration therapy for her child with diarrhea. Check their abilities to convey complex information clearly and empathetically. Next, the skill station, representing hands-on evaluation. Think of it as testing students on their abilities to perform specific tasks. For example, doing an intravenous cannulation procedure requires a mix of theoretical understanding and practical skill.
Maybe ma'am, kindly cancel your screen. The screen share is free.
Last station is race station. This provides a unique chance for students to organize their thoughts, recognize the importance of mental preparation and planning, giving students a moment to collect ideas. Before moving the next station, ensuring a more thoughtful and composed response. Next, competencies tested in OSCE station. OSCE tests four main areas of competence. In that, first, history taking. There is not time to take a whole history, but one aspect can be looked at. First is the history taking. OSCE focuses on the one aspect due to time constraint because it is time consuming. This allows examiners to assess a student's skill in efficiently extracting essential information from a patient, a crucial ability in clinical setting where time is often limited. Next, explanation. Students are asked to explain something to the patient. Example, what an investigation means or how to take a treatment. This area tests a student capacity to convey medical information to a patient, whether explaining a diagnostic investigation significance or guiding through a treatment regimen. It know the ability to communicate complex medical details in understandable way. Next is a clinical examinations. Students are asked to perform an examination. This might be healthy person, a simulated patient, or mannequin to allow examination of more sensitive areas. Students are challenged to perform hands-on examination, possibly involving healthy individual, simulated patient, or mannequins for one more sensitive areas. This assess technical proficiencies, professionalism, and the ability to ensure patient comfort during examination. The next, procedure. Student may be asked to show how to do procedure. Example, IV cannulation or catheterization on the mannequin. In this segment, students showcase their proficiency in nursing procedure from delicate skill like IV cannulation or catheterization. The use of mannequin provide a controlled and safe environment for assessment, ensuring student can demonstrate their abilities effectively. Next, uses of OSCE. First is it is hand-on. It is hands-on, not just all about books. It lets you show off what you can really do in controlled setting, giving a full picture of your skill. Next is a real-world approach to learning. OSCE keeps it real by throwing you into life situation. It's like practicing for but deal real deal, but in safe space. Get ready to test your skill in setup that feel just like actual job. Keep examiners engaged. In OSCE, you are not just a spectator. You are in the game. It keeps you on your toes, making you pay attention, be quick on your feet, and take charge. No passive learning here. Next, challenges the professional to be innovative. OSCE is no walk in the park. It pushes pros to think outside the box, handle different situations, and come up with clever solutions. It's about getting better and staying sharp when the things get tricky. Next, the reveals their errors. Making mistake is a part of our game in OSCE. But here the cool part is it's a safe space to mess up. You learn from slip ups, fix them, and level up your skill in chill and controlled setup. Next, provides an open space for improved decision making. OSCE throws you into a real scenario, testing how you make decision on the fly. It's like a sneak peek into the professional world, helping you get your decision making game strong. Next, based on evidence based practice for real world responsibilities. In OSCE, we keep it real, back it with facts. The skill we are test are not just random, they are what's happening in the professional world right now. It's all about staying up to date and being on top of your game. Next, this allows for review of teaching technique and curriculum. With OSCE, teachers can check how well they are teaching in fair way. The setup lets them objectively see what working and tweak things if needed. It's like a report card for teaching method. OSCE takes much shorter time. OSCE is not just for few students or one subject. It's a champ at handling lots of students and a bunch of different topics at once. Efficiency is the name of the game here. Next, the performance is judged by the team of many examiners in charge of the various situations of the examination. In the OSCE, it's team efforts. Examiner tag team different parts of the test. This tag team approach ensure a complete and fair evaluation of how well you are doing in the exam. Next, to, to the advantage of both examining and teaching standard of institution. OSCE keeps it real by using a set of format and many examiners. This combo makes sure nobody plays favorite. Each student gets fair shot, and it's all about how well you perform, no string attached. Last one, outcome of examination is not affected by prejudice. The summary of this session, OSCE have become accepted practice. They are fairer measure of competence than previous method. And last one, contribute to more defensible examination. Why OSCE below? Simple, they are super and reliable, unlike old school tests. OSCE keeps things structured and standard. Here, no surprise is there. Everyone will get a same scenario and same rules, making sure we all get fair shot. But wait, there's more. OSCE are like anti-bias superheroes. The way they are set up minimize any personal opinions and favoritism. It's level playing field for everyone to show off their skills. Thank you.
Thank you, sir. The session is open for discussion. Participants, if you have any queries or any doubts, you can ask. Participants, if you have any queries or any doubt, you can ask. I think there are no any questions. Moving forward, thank you, sir, for enlightening insight into the mastering OSCE. Your expertise has certainly provided our audience with valuable knowledge that will contribute to their professional growth. This knowledge will help us during practical application of OSCE. Thank you, sir. Moving towards second section, I kindly request Ms. Tejaswini Kalekar, Department of Medical Surgical Nursing, to start with the section on formulation of OSCE stations.
Good afternoon. Myself Ms. Tejaswini Kalekar, Department of Medical Surgical Nursing, MES College of Nursing. Today's my topic is the formulation of OSCE station. So let's see how we are going to formulate the OSCE station. Before we start to the topic, let's make sure we are all on the same page. OSCE stands for Objective Structured Clinical Examination. It's a method used to assess clinical skill in a controlled and structured environment. It's like a simulation where you are getting to show what you have learned in a theory and you are going to apply it in a simulation, and you will be minimizing the errors in a real life setting. The OSCE is like a play. It's like a play, and there you have different scenes in the play. Like that, OSCE is there. Sorry.
Slideshow.
Yes, ma'am.
Sorry, the problem has resolved. So this topic is formulation of OSCE station. So before moving forward, we'll make confirm that we are on the same page. The OSCE is objective structured clinical examination. Here, the structured and controlled examination is there where students are performing their skill. It's like a simulation we showcasing what we have learned in the theory and before we are actually practicing in the hospital scenario. The stations in OSCE are like a different scenes of the play, where all are given their roles, all simulated patient, examiner have been given their roles and they have to act according to their roles. And also the student nurse is going to act according to the given instruction. So sometimes this station will be the manned or unmanned. So when the manned station will be there, the simulated patient will be there. So there will be a script or it is like a scene of some plays. Also you can imagine it as it's like a puzzle. So you are going to for the station one and you are going to solve that puzzle. Then after ringing the bell, you are going to move to the second puzzle. And likewise you are the students are moving throughout the OSCE station. So the OSCE when you are formulating the OSCE station, the main thing is you have to specify the objective what you are going to assess in the student. Then you have to create real world scenario, though the simulated patients are playing the role, but scenario should be real world and there will be the integration of key skill and the knowledge. So OSCE is not limited to some procedures. There will be other domains we are going to measure, like interpretation of data, and the student will be doing the decision making or the problem solving. The all things we assess in the OSCE. Let's move forward. The principle of formulation of OSCE station. So first is the skill to be tested is given in the form of a specific question. So suppose you have a whole syllabus of some any subject and you have to assess your student from a point of view of each unit. So you have to specify in the unit what specific question you have to ask in the OSCE or what specific skill you are going to test in OSCE. So based upon that you have to form the specific question. Like in a respiratory system, if you are going to check the particular sign and symptoms students are aware about it or not, so you will be creating a virtual sign identification session and you can ask in that. Then it's to be answered in a 4 to 5 minutes. So usually the stations will have about time about 5 minutes, but it should be equal for all the stations. Like station one should be for the 5 minutes as well as all the station for the 5 minutes. So can it will be going on smooth and in an equal duration. Then each question is a station. So whenever you are going to formulate the objectives, whenever you are going to set the scenarios or you are going to check the specific skill, you are going to form it in a specific question that you have to ask in the student. Like in a GIS system, if you want to ask your student the appendicitis specific abdominal examination, so your station should be uh, prepared like that. Your question or your instruction to the student will be according to that. Next is for each question or station, a checklist is prepared in advance. So, while formulating the OSCE station, you have to keep remember when there is a man station, there is a,
Raju Singh sir, please kindly switch off your mic.
okay. So moving towards the fourth principle, for each question or station, a checklist is prepared in advance. So whenever you are formulating the station, you are going to see the station will be manned or unmanned. Whenever there is a simulated patient or your student is going to perform the procedure on the dummy, there should be a checklist well prepared so that the examiner who is going to sit on that station will be well prepared, or they will be checking the each point the students are going to perform. Okay. Then last is a checklist is prepared by breaking the skill to be tested into its vital components that are to be observed. Okay. So when suppose I'm going to check the skill of the procedure mouth care. So I'll be dividing this procedure into the three components: communication of actual procedural skill and the decision making of the student regarding the biomedical vest. So communication skill will be the first 2 to 3 point, whether where student is actually going to communicate with the patient while doing the mouth care. Then the second thing is the procedural steps. So you are going to make the checklist according to that. The procedural steps should be there. And last one is the biomedical waste. You are going the component you are going to assess. So you are going to check that student is disposing or segregating that waste according to the criteria of biomedical waste or not. So you should divide that checklist into the three main components. Your objective will be based on these three components. Your examiner or your evaluator will be checking the communication of the student, procedural skill, and third one is the biomedical waste management. Moving forward, we are going to see the main component of the formulation of OSCE station is the assessment areas for OSCE evaluation. So how to identify the testable skill from the each of your academic in your syllabus. So first one, taking history of the patient. So sometimes the OSCE you cannot assess this you cannot assess any skill related to any unit or any particular component where you can ask the student to perform the history taking session. So you can here uh, call a simulated patient, and there will be a scenario, and this session will be man station. History taking session will be the man station. There will be a simulated patient, there will be evaluator, and the specific scenario will be given to that simulated patient, and specific disease related history will be given, and student will be asking the question regarding the history, and evaluator is going to assess whether the all points in that history the student is taking or not. Then evaluation of physical signs of the disease, that is virtual sign identification. In this type of skill, you can actually put the printed material on the station. Here you do not need to appoint the evaluator in this type of station. This station will be unmanned station. Here you have to keep the printed material where you have to print the color images of the particular signs of diseases or any diagnostic procedure. So students are going to identify, they will write down in their answer sheet, and it will be evaluated later. So this type of session will be unmanned station. Third one is a performing examination of specific system. So performing physical examination, whole physical examination is not possible in the OSCE because it is time bounded. So you can perform the specific systemic examination. Like I said, you can ask the abdominal examination, or you can give a specific test like assessing the vision of the eye, and the checking the hearing acuity. Like specific skill you can check in the performing specific physical examination. Then the fourth one is identification of abnormal test finding. So in the identification of abnormal test finding skill, you can here give the like X-ray films you can put, and you can ask the student to identify whether there is a presence of fracture in that X-ray film or not, whether there is any or also you can give reports of some diagnostic evaluation, and you can ask the student to find the abnormality. Like that, this type of station you can conduct. Moving forward, interpretation of test result. See, so in that type of skill, you can give a specific values, like we interpretation of arterial blood gas level. So here you can give a specific values, and you can ask the student to interpret the test result. For example, here you can give a ECG, particular ECG, and you can display there, and you can ask the student to identify the ECG changes. Also, you can give some electrolyte imbalance, and you can ask the student to interpret it. Next one is management of patient, that is therapeutic procedure. So here the therapeutic procedure like bandaging, like vital sign assessment, mouth care, any procedure you can give. But the stations you have created this all the station, that therapeutic procedure should fit into that time limit, like that the procedure you can apply. Next one is a diagnostic procedure. So in a diagnostic procedure also you can ask the student to prepare the prepare the patient for specific diagnostic procedure, and here this station will be also manned or unmanned. The simulated patient will the station will be manned. The simulated patient will be there, and you can ask the student to giving the instruction prior conducting any diagnostic evaluation. So how that's how you are going to assess this station. And the next one is health education. So health education is in this session you are going to assess the communication skill of the student. So here there will be a patient. You should be a specific. You are going to you give the scenario to the simulated patient, and student will be given the specific instruction that they don't have to collect the history, or they don't have to do any procedure. They just have to give the health education on the basis of disease condition of the patient. Like if the patient is a hypertensive, you can give the ask the student to give them the health education on the lifestyle modification, like that. Moving forward, so major steps in a formulation of OSCE are: first one is the development of blueprint for a whole course. So prior conducting the OSCE, you have to develop the blueprint like we develop in the question paper setting. That for each unit, you have to choose the what domain you are going to assess in the student. That might be different for the different unit. If you are checking the interpretation of result for the cardiovascular system, if then you are checking for the GI, if you are choosing the domain for the GI system, that will be an examination. If you are choosing for the musculoskeletal system, there will be an interpretation of result. So likewise, different domains you can choose according to the component of your syllabus. Then the next station is a next point is a planning for OSCE station. So planning for OSCE station, here you have to plan all the things. You have to keep ready, that we are going to see further, that all the logistic, all the stationery supply, you have to prepare the one patient. So all this supply you have to keep ready. Then the development of scenarios. when you are choosing the domain, that time you have to choose, also develop the scenario. When you are choosing the domain, that time you will be knowing that the station will be manned or unmanned. So your station is manned, there will be a simulated patient. So for the simulated patient, you have to give the scenario to that particular patient. Then fourth, the write down instruction. So you have to write down the instruction for all three of them, for the student, for the simulated patient, and for the examiner. So they will be conducting their role according to that. Then the setting up for the station, that will be you are doing prior the day, you are conducting the asking. So whatever the preparation you have done, uh, by collecting that, you are setting up the station. You are going to keep the all stations ready, all the you are going to give the script to the your simulated patient, and your evaluator should be ready with their checklist. And the six is the testing. So this will be a step you're going to conduct on that day of the hosking. So testing is nothing but the evaluation. So evaluation will be there in the when the man station is there. So exactly your evaluator will be there, and that time only they are going to evaluate that station. And if the station is unmanned, then the student will write down their answer in the answer sheet, and then it will be evaluated later on. And seventh one is the providing feedback. So after conducting the asking, you have to give the feedback to the student. You have to tell them what were the pros and cons, and how they are going to improve it in the next examination. So this is the blueprint example I am giving.
Alternate ma'am, please kindly switch off your mic. Alternate ma'am, kindly switch off your mic. Yes.
Okay, so this is the example of blueprint, like in the fundamental of nursing. So here we have created the 8 station. So you have to specify the type of station. So here the first station is a manned station, and all others are the unmanned station. You have to specify the program component which you are going to assess. So here the oxygenation, the first station, if you are taking the example of first station, the program component that I'm going to check is oxygenation. And what the item title, that is what condition you are going to assess, that is CPR. And here I will be testing the competency, that is therapeutic procedure. So in the unit of oxygenation, how the student are performing the CPR, that therapeutic procedure I am going to assess. Then the domains are communication, examination, then the procedure, and the cognitive skills are there. So it will be fit in the procedure that your student is going to conduct the therapeutic procedure. So likewise, you have to create the blueprint prior you are conducting any OSCE examination, and so it will be more useful for you to create the all scenarios, and you to create the all station. Moving forward, setting up the station. So each your station should have a station profile. Then station profile means which type of station is that, on what basis or domain basis the station is formed. But that information should not reveal to the student, that will be to the evaluator. Then the station number. So your each station, it should be labeled with the number, like station 1, station 2, station 3. Meanwhile, you can keep the rest station. And then the scenario or the instruction to the examinee and the student. So you have to give the specific instruction to the student, that should be pasted in the OSCE, on the OSCE station, on a particular table or you can put it in the on the wall. So there should be some instruction to students, so what exactly how or how they have to perform that skill. Then the instruction to the examiner. So examiner should be given with the objectives, what they are going to check, the component they are going to check, and how they are going to mark that the skill. That all the instructions should be given to the examiner. Also we give the evaluation checklist to the examiner. And fourth one is instruction to the simulated patient. It should be given prior conducting the OSCE. You can give it to the prior day or prior 1 to 2 hour conducting the OSCE, so that simulated patient will be thorough about his condition, his name, or all the data you have given to for the role playing to that simulated patient. Next. So here I have given some example. So like station 1, I have created the therapeutic procedure of eye bandage. So while giving the instruction to examiner, like that sheet you have to create, and you have to actually this type of sheet give to the examiner. So they will be clear with their roles. So you have to specify the objective, and you have to cut down the component, what component they have to assess. So here the procedure is eye bandage, but I have asked the examiner to assess the component, that greeting the patient, introduction of self, and applying the bandages and the documentation. These four components they are mainly going to check. Then the observation. So they are you have to give the actual what observation they have to do during the student is conducting any procedure. And the scoring. So explanation of scoring should be there, because each station or each procedure will be have a different scoring system. So here we have given the scoring in the three system. There is score 2 for performing the step perfectly, and score 1 is performing the steps appropriately without neat appearance, and 0 will be given when the student is does not perform any step. And they will be calculating the score at the end of the OSCE station. Likewise, they are going to do this for all the students who are moving through that station. Next one is information to the simulated patient. Like I said, this information you have to give prior 1 to 2 hour or prior 1 day to the simulated patient whom you have chosen. So you have to give them their role. Their role will be the patient, their name, their age, what will be their educational qualification, what will be their marital status, what is their occupation, all the things which the student usually ask in the history, or we usually ask to patient, that all the things they have to give. And also the patient's chief complaints you have to give. Based on that, the student is going to conduct the therapeutic procedure. So that the role play script, you can say, you have to give to the simulated patient. Next one is the instruction to the examinee, that you have to post uh, on your station, like that. If I like I am given Miss Kumuda, 53-year-old lady, having inoculation surgery on her left eye before 2 days. So student will be having the baseline data about that patient. So they will be not losing their time, and they will be going to do what is ask them to do. Otherwise, what happens in other scenario, if you go and approach to the patient, we first ask their name, we collect the history, we ask them their chief complaints, and then we move towards the whatever therapeutic procedure we are going to do. But it will lose the time of that particular student. So all the information should be given in the instruction format, and student will actually perform the procedure only, what is the main objective of our OSCE station. Then the scoring and marking. So you can form a checklist or the rating scale that can be used. It should be prepared by the coordinating committee or the examiner. So if you are a particular subject teacher, and you or your department is looking after that particular subject, so you have to kept ready the checklist for the particular OSCE station. So option can be yes, no, completely, partially, or or not done. Likewise, so if in a previous slide I have given the example, in that I have used this type of evaluation. Then the global scoring you can use. Pass fail may be determined based on the score on the checklist and the rating or the global score. So you have to set the criteria where you are going to call it student has a pass that OSCE or failed that OSCE. The evaluation can be satisfactory and unsatisfactory. The performance or pass fail, but adequate justification should be given for this type of evaluation. So better to go with the yes no or completely or partially or not done, like or you can go with the checklist. So here you can definitely give the marks and you can uh, prepare the result that student has passed or failed. So global score, you can use that outstanding, very good, pass, borderline, and fail. And each score in the given has a should have a specific criteria. Means if you are given for the particular state the outstanding, so how you are expecting that should be given in your answer key. So how when you are going to give a rating outstanding, when you are going to give the rating very good, when you are going to give the rating pass. So like that you have to perform the evaluation checklist. It is an example of evaluation checklist I am giving. So it is for the same station, the example I have created, the therapeutic procedure of eye bandage. So here also we have given the marking in the three component, that is if we are going to give the 2 marks for fully competent, 1 mark for the partially competent and 0 for incompetent. So at the end, the evaluator will be totaling the marks and they will be declare the student has passed OSCE or failed OSCE. Next, list of resources you will be needing for the formulation of OSCE station. So you should have enough space for formulation of OSCE station. The area should be enclosed for each station. So if you are creating the 5 station, you may be creating the 7 station, 10 or 15 station. So each station will be should be divided from the other station. It should be enclosed and there should be a partition or the curtains should be there. So other station cannot be visible from the first station. Then furniture, so necessary furniture you have to bring on that particular OSCE station. So if that is a man station and student is going to perform the procedure, so you will need the table and chair for the evaluator. So like that furniture you have to bring that particular OSCE station. Then the article for examination and testing. So if you have asked the student to do the therapeutic procedure, you have to keep ready the tray of particular therapeutic procedure. Like in example I have given the eye bandaging procedure. So as an examiner or as a coordinated team, I have to keep ready the tray of eye bandaging at the bedside. So student will be reading the scenario and student is just going to perform the procedure on that patient. Then pre-packed item and the description of the content, that will be the if you have a pre-packed item, so description of the content should be given and the what instruction you are going to give to the student, that will be clearly displayed on that station. Also you will be needing stationery material, so that you have to keep the ready. Next, space for OSCE station. So you have to get enough space. You can create the OSCE station in your own laboratory or you can have your own OSCE lab. So here in the example there are 10 stations. So each station is based on the different domain, different skill you are going to check. So some of the station will be man station, some of the station will be checking the students' knowledge about their how they are interpreting the data, how they are identifying the sign, how they are uh, conducting the any therapeutic procedure, or how they are going to give the health education. So like that all the station you have to create, but you have to keep it in the mind that the all station should be divided by the others. The other two or any those stations adjacent to each other will be not visible to any of them. So that you have to keep in mind. So structure should be like we have the scenario in intensive care unit. So if there each patient have their different area and the curtains are there. So like that you have to uh, prepare your OSCE station. Next, so what equipment and artifact you will be needing, so that you have to make a list. For example, so in a station one, like in a therapeutic procedure of eye bandage, I'll be needing the, for examiner, I'll need the writing pad with the instruction to the examiner and evaluation pro forma, tray for evaluated response sheet. So each student will be giving the response sheets to the evaluator and he will be keeping in the tray. Then you will be needing pen, pencil, scale, sharpener, eraser, and chair and table. These things you will need for the examiner. Then the first stimulated patient, the cot with screen will be there. Then the top sheet should be there, writing pad with the case scenario. So they will be reading that scenario and they will be acting according to that. Then the instruction for the simulated patient to be that instruction to the simulated patient will should be given prior to OSCE. And also you have to keep the ready material for the examinee, like a writing pad with the instruction to the examinee. Bedside locker should be there, so they can write, or if it's not available, you can keep the chair and table so they can write their response on that. A well prepared clean tray, uh, so here well prepared clean tray for the eye bandage procedure. If that is not a procedure, therapeutic procedure, so you will be need another thing. You will, if it is virtual sign identification or it is station related to interpretation of data, so you will not need the clean tray, or you will not need the all the things like cot with screen. You will just need the table where you have to paste that printed material and student have to identify and they have to write in the response sheet. Then you will be needing chair and table and pen for the examining. So all these logistics supply you have to keep ready while preparing the OSCE station. Moving forward, so what methodology you have to use? The student during the examination moves around the number of stations. So like I said previously, it is like a puzzle. You have to solve one puzzle, you have to move forward. If you then you have to solve the second puzzle, you have to move to the third station. Like that scenario will be there. So if there are a 7 station, your every student have to move through the all 7 stations. The time allotted at each station is 4 to 5 minutes. So usually the 4 to 5 minute time will be there, and on signal bell will be buzzed by the timekeeper. So on the ringing the bell or on the signal, the student will be moving to the next station. So while you are starting the station, you have to keep the you have to give the bell. So first student will go to the station 1. Then after 5 minutes you will ring the bell again. So student who is in the station 1 move towards the station 2, and another student will go to the station 1. Likewise they have to move. Then, depending on the curriculum, the purpose and the domain of the station must be clearly defined. That we have seen, you have to here create the blueprint. So, how your curriculum is planned, on what objective the curriculum is planned, you have to create the domain or prepare the domain, and the purpose should be clearly defined, and depending on that you have to prepare the blueprint, and you have to give if all the you have to prepare the blueprint for all the units, all the components, and you have to give the specific component you are going to ask in that unit. Then each steps in a checklist can be given differential marks depending on the performance. So you have to like in a previous slide we have seen the evaluation format. So each point you have a marking system. So for each successful step you are going to give the marks. So you are going to give the marks on the performance. So if they have completely performed that procedure, you are going to give the 2 full marks. If they are going to perform that partially, you are going to give the 1 mark. And not if they are not performing, you are going to give the 0. A provision can be made for the negative scoring. So in case of the important omission or the mistake with the significant consequence, negative score is given. Okay, though we usually not apply in the OSCE, but sometimes the students, I mean, OSCE is not, if it is, even though it is not related to the real patient, but if your student is performing that particular step in a OSCE scenario, there are chances they will be committing it in the real scenario. So negative scoring should be there for the specific procedure, like the right tube feeding. The position of the patient is very much necessary. So if your student has skipped that step, so you can give a negative scoring on that step to your student. Same examiner examines the competency at one fixed station and the student get rotated. So suppose on what example we have taken of the eye bandage on the station 1, if I am the evaluator who is sat on that station, so I will be a examiner for all the students. I will be on the station 1 only throughout the all the OSCE circuit as mode. And time allotment is the same for all students. So student will be moving smoothly. So like I said, 5 minutes time allotment will be there. Then the gap station, rest station can be planned if more time is required in a one station. So and otherwise you can also keep the rest station. So if there are a more station like a 10 or 15 station or 8 station, or even there are a 5 station, you can keep a rest station in between. So their students will not do anything in that station. They will be recalling whatever they have seen in the other station, and they'll be preparing themselves for the next station. Then the examiner's checklist and the student answer sheet are predetermined. So examiner's checklist should be prepared and the student's answer sheet. So that will examiner checklist will be there when the student is performing the therapeutic procedure, and student answer sheet you will be collecting for the uh, unmanned station, like I said, virtual sign identification, interpretation of data. So like in that you have to collect the answer sheet from the students. So sequencing of the station and the direction of movement. So here it is given in the example. So student have to move from the station 1 to station 7. So a sequence should be maintained. So the first OSCE circuit is for 7 stations. So each student have to move through all stations, and you have to create one waiting area for prior students are moving throughout the session. So number of station can be less if OSCE is conducted along with the clinical examination in the wards. So you can keep a 3 to 4 station also, at all maximum you can keep a 5 stations. Then the hall arrangement. So further instruction that are needed, that students waiting room, the if the classroom your classroom should be adjacent to your OSCE lab. So there will be a students waiting for their next station, or for their number. So there will be a allotment of the waiting room, and the students waiting area after the examination should be there. So no information will be disclosed to the any students, and your scenarios will be kept the secret. So there will be a 2 additional waiting room adjacent to your OSCE station should be there. A students waiting room before the starting of OSCE station, and students waiting area after the OSCE examination. Also in the hall arrangement, exam date, time, venue, and the OSCE circuit should be displayed on your bulletin board or your notice board of your OSCE lab. Next, now moving forward, we'll see the organization of the OSCE station. what actually you are going to see or you are going to do prior formulating the OSCE station. So first one is the advanced planning for OSCE. Second one is the organization on the day before the examination. And third one is the on the day examination. And fourth one is the after examination. So in the advanced planning, examiner must decide on the content for the examination from the blueprint. So in the first on our starting of our lecture, we have seen that we have created the blueprint. So as an examiner or as a coordinating team, you have to keep ready your blueprint. For this will come in the advanced planning. Then you have to prepare the scenario. So question how to be prepared. So based on the domain you have prepared in the blueprint, so scenario should be made, and you have to perform the question you are going to ask to your students. For example, like I said, the I'm going. My question is to assessing the abdominal examination for the patient of appendicitis. So I'll be creating the scenario. I'll be giving this. I'll be creating the script for the patient who is having the sign of appendicitis, and my student will go to that patient, simulated patient. They will actually perform that examination. Weightage to be given to various components. So all the components, if I'm checking, if I'm conducting any specific examination, so I have to give the weightage. So what sign, if my student is performed this state, so I have to give the this much of the weightage to for that particular state. If, so that you have to specify. Then the marking scheme. So what are the minimum pass marks or when the student will be mastering for the, in that skill, so that marking scheme you have to keep ready. Then the co-examiners and the helping staff need to be briefed. So they, as a planning committee or your, as a coordinating committee, you should have a co-examiners in the OSCE. Definitely you will need more than one examiner because there are many station we are formulating. So one examiner will be on the one station only. So if your station man station are 3 to 4 man station, so you will be needing the 3 to 4 examiner in the OSCE formation. So and also you will need the helping staff. So who will be one will be timekeeper, one will be running the bed. So they all should be briefed advancedly. Then the selection of patient and briefing scenario. So you have to select the patient. You can take your other students also, not from that particular batch, but other batch. Also, you can ask the any volunteer who are going to be your simulated patient. So you have to select the patient, brief them how they are going to behave, how they are going to role playing their scenario, and you have to give the actual scenario to them priority. Then they keep the simulators ready. So sometimes the man station will be always not on your simulated patient. You have to perform some therapeutic procedure on the simulator, like cardiopulmonary resuscitation. You are going to perform on the simulator. So you have to keep ready your simulators also priority. Next, you have to create one team. So team will be the in that there will be a coordinator, examiner, and the timekeeper. So coordinator is responsible for the detailed organization of the exam and can be one of the examiner. So coordinator, you are who is examining examiners if needed. So like I said, that you cannot be rely on the one or two examiner. You will be needing the 4 to 5 examiner based on your station. So if there is a station which is manned, or you have to your students is going to perform the actual procedure, there you will need a examiner, and you will be needing a timekeeper, that also your team member, so person to brief the student and guide them and keep the time. So stopwatch will be there with the timekeeper, and bell should be there with the timekeeper, who will be ringing the bell after the 5 minutes, and also that person will be briefing the students prior they are entering in the your OSCE station. So they will be instructing about the time, they will be showing the OSCE circuit to them, how they are going to move throughout the examination. Then other documents. So other documents you will be need in the preparation, that is list of students. So based on the list of students, you can plan the circuit. So if your number of students are 15, so you can plan how many OSCE station you have to plan uh, to accommodate all the students in the OSCE examination. Then instruction to the students you have to prepare. It's like in the example we have seen. So instruction to the students will be different for all the station. What example I have given, it was for the therapeutic procedure. If you are conducting the virtual sign identification, or if your station is related to health education, so your instruction should be specific to that only. You have to clearly mention what student have to do only. Like in the health education, you don't have to ask your student to collect the history or physical examination or anything. You just ask the student to give the health education to your patient. Then the instruction to the examiner. This is also, we have seen the example in the previous slides. So examiner should be given the instruction related to the what domains they have to focus, what component they have to focus, what actual role they are going to perform, what they are going to observe, and they are going to brief with you are going to brief them with the examination. We, sorry, with the marking system, how they are going to allot the marks. Then list of all station with the checklist. So as a team coordinator or as a subject teacher, you have to list of all station with the checklist. You should keep it ready with you, so you can distribute on the day of examination to your examiners. Then you have to keep ready the answer sheet, because that answer sheet you are going to give to your students, and that should be given just prior to starting the OSCE station. A set of general instructions. Then what general instruction you are going to give to your students, that should be given prior they are entering into the OSCE station. It should be you can give this in waiting area, or just outside your OSCE station. A plan of location of station and direction of movement, that should be a pre-plan, so that you have like you are creating the blueprint of your OSCE station. Likewise, you also like that you also have uh, location, how the students are moving forward. I have shown the previously the OSCE circuit. That type of circuit you have to make. So station 1 is manned, station 2 is unmanned, station 3 is manned or unmanned. Likewise, you have to create one location of the station and direction, how the students are moving. In the place of waiting before and after exam, an indications of the station where she should start. So where students are sitting prior the OSCE examination, where you are going to give a indication or the instruction to the students, how they are going to start, how they are going to move forward, how they are going to conduct all their OSCE examination. Then the plain should to make a plain sheet to make a note. So you will be providing the plain sheet if they want to make a note. So that will be kept ready on the OSCE station. Then patient selection. So mobilize patient as per need. On which OSCE station you need a simulated patient. So like that you have to mobilize that patient. Then examine each patient by both coordinator and examiner. Finalize the question and checklist. So based upon your domain, you have to prepare the question and examine examine that patient, the simulated patient you have to examine, and based on your checklist and your question, you have to give the scenario to that patient. Two similar patients for one station if more number of students for the exam. If you have a student 30 students, so once you can keep a two simulated patients. So after 15 students, you can change that simulated patient, but scenario should be same. The person will be different who is going to play the role of that simulated patient. Simulated patient can be chosen that standardized patient, that like I said, you can take any volunteer or you can take a student for the another batch or another course, and give necessary instruction to the patient for replication of history. So like I said, you have to give the script or all the instruction to the simulated patient. So according to that, they have to give the answer to the student. So there will be a uniformity and the better control of the ASCII examination will be there. Second part of the organization of OSCE is the preparation. What you have to do the prior to exam, just prior to exam. So prepare the hall place with the necessary instrument and the article adequate in the quantity and the working condition. So you have to prepare your hall or the OSCE place with the necessary instrument. Like in example, you have seen if your student you have given the domain of the therapeutic procedure, student is going to conduct the procedure of eye bandaging. You are going to keep the ready the necessary instrument, necessary equipment or articles you are going to students will need on that particular station. Do the layout and see for the placement of station. Like I said, we create blueprint. So you have to create the layout for the placement of the station and how actually the student is going to move. Brief the examiner of their roles and the documents that they will handle. So prior exam or prior day, you have to brief the examiners their role and the documents they will handle. So you have to brief them about the checklist, brief them about the collecting the answer sheet, and also brief them about their role they are going to actually perform by sitting on that particular station. Third, what you have to do on the day of exam while organizing the OSCE stations. All set ready an hour before exam time. So if your exam is on, you are starting the OSCE station on the 10 a.m. So by the 9 a.m. all your preparation should be ready, because if there are any mistake or any changes you are going to do in between the stations, this will be the bias to the student, because sometimes it may happen that some equipments are ready in the for first 4 to 5 station, then you realize that particular instrument or particular equipment is not working, and then you are going to change that equipment. It is going to be the bias to the student. So all set you have to keep ready before the exam time. Then brief the student. Like I said, you have to brief the student prior they are entering the OSCE room or OSCE station. So wherever they are getting prior to the OSCE examination, you have to brief the students. Your timekeeper or your person who is going to coordinator who is going to rank the bell will be briefing the student and telling them the all instruction how they are going to move all the throughout the station. Then ensure students display their examination number prominently. As it is an examination, so students' names will not be displayed. So students' examination number should be displayed. So they have to put their examination number like we put the nameplate. Then ensure all examiners are in the position at their station. So prior starting the station, prior ringing the bell or prior starting your stopwatch, your examiner should take their place or they have to take their position at their particular station. Move students to the exam hall. Then you are going to move them to the exam hall and start the signal. First wave you are going to rank. Then the student will move on the first bell. The one student will be entering on the station one, then second, and other bells are you are kept ringing, so student will be moving from their station to the next station. Next, you have to keep the timekeeper, and they will ring the bell in the interval of 5 minutes. Next, on the day of exam, all other things you have to do, that is, the examiner completes the assessment and marks the score for every student. Where the examiner is sitting in the therapeutic procedural skill station or the man station. So examiners will be assessing the skill on the time that student is performing that particular skill, and that time only they are going to put the marks. Then list of students with the marks are handed over to the coordinator and examiners as mandated. So after the conducting the all OSCE station, so list of the student and all the checklist that examiner should hand over to the coordinator, who is actually going to coordinate the all the OSCE station. The scenarios are kept confidential till all the students complete the examination. So for that only we should have a two waiting areas just before the your OSCE lab, one waiting area prior starting the examination, and second waiting area after your OSCE lab, after the patient student are completing their examination. So the scenario will be kept confidential till the end of examination. Moving forward, the pro you can you have to provide the refreshment and meal to the patient who are your simulated patient, who actually going to take care of them. So you are going to give the refreshment and the meals to the patient. If the uh, exam is for whole day, so you have to give the meal to that particular patient. You make necessary arrangement to transport to ward or the home. So who are the voluntary students are participating in that examination for the they are being the simulated patient. So you have to make the necessary arrangement for them and make arrangement for the incentives, and thank them after the examination and thank the team and the examiner. And what you have to do after the examination, that is compute the result as planned. So as I said, the student will be pass or fail, that will be declared after any station. So you have to compute the result, provide the feedback to the student as soon as possible. So after conducting the OSCE station, after you have done with the computing or evaluating your all the sheets, you have to give the feedback to your students. Then distribute a checklist to individual student with the examiner's comment. So there will be no knowing what the mistakes they have performed, and they'll be improving in their next examination. Give the correct answers. So if some students are missed the any steps or any skill, so you have to give the correct answer. For that, you have to keep ready the key answer with you, so you can easily give them after the examination. Discuss their areas of performance that has been poor, and repeat if scored lower than the standard score. Some station may need video tapping, and some station need the video tapping, like the unmanned station. So you can keep there the video camera on, so you can record that station, and the post hoc exam analysis should be given. So student will be well know what are there the poor areas where they were poor, what are the areas where they performed well. So that feedback after the examination you have to give to your students. In a summary, OSCE so far, we know that OSCE needs a careful planning and the execution, and examiners need to be thorough about the procedure and conduction of the OSCE, because unlike in a traditional examination in OSCE, you have to be ready, you have to keep the all logistic, all the checklist, all the articles, and all the supplies ready prior to the examination, and students need to know what they are expected to do. So your instruction should be what checkpoints they are going to check, and the feedback on a performance can be given to the student at the end of examination, so your student will be better performing in their next examination. Thank you.
Participants, if you have any doubts, you can ask. I think there are no more questions. Thank you, ma'am. As this informative session has provided our audience with a comprehensive understanding of the nuance involved in creating meaningful and challenging clinical scenarios. Yes, Shivanya, ma'am. Shivanya, ma'am. You can ask your doubt. I think there are no more questions. Thank you, ma'am. As this informative session has provided our audience with a comprehensive understanding of the nuance involved in creating meaningful and challenging clinical scenarios. We are truly grateful for your time and expertise. Throughout the session, we learned about the significance of. I hope we are now better prepared to apply these insights in our respective fields. As we are progressing in our journey of the professional growth, it is crucial to explore and understand the strength and weakness of OSCE, a method that plays a significant role in assessing the clinical competencies. Now, I request Professor Lingaraju AR, MES College of Nursing, with his extensive knowledge and experience, kindly shed light on the intricacies of the OSCE and unveil its strengths and weakness for our professional development. I request sir to start with the session.
PPT
त्याला असिस्ट कर इंट्रोडक्शन कॅमेरा ऑन करून इंट्रोडक्शन त्यानंतर येतो
Okay, very good afternoon, everyone. I am Lingaraj, Professor, MES College of Nursing. I would like to welcome all of you for the orientation program regarding the OSCE. So, today we have seen a brief introduction about the OSCE as well as the different stations related to the OSCE and how to create and what are the major steps to be included when we create that OSCE. So, at the end, that means today, I am going to end up the session with the most important one, that are the strength as well as the weakness of this OSCE. And before this, I would like to thank you, Indian Nursing Council as well as the Maharashtra University of Health Sciences for the application of the OSCE in the evaluation of nursing students' clinical skills. Because in the earlier days, or when we were studying in the BSc Nursing, we were using the traditional methods, and most of that time
We are just asking the questions to the students and getting the answers related to the subject. But very minimally, we were evaluating the communication as well as the clinical skills performed by the students. By performing the OSCE in a particular lab or in a particular department, now we can improve the students' strength as well as the students' performances, even the clinical skills and other professional roles. So here I am going to start with the strength as well as the weakness of the OSCE. So first one is, as we know that definitely the OSCE is one type of evaluation method of nursing students, where whatever the students has learned in the clinicals or whatever the students has learned in the classrooms, that all will be evaluated in a single platform. So that we say it as a OSCE, where students will be performed on a particular task, on a particular area, and that particular skill or that particular incidents alone will be evaluated from the students. So that's the major benefit of the students, benefit for the students and even for the examiners. First and foremost, when we come to the strengths of this OSCE, definitely OSCE is considered as one of the excellent method of evaluation where students' professional role will be evaluated. See, in the traditional methods or in the earlier days, we were not the particular to the students. That means if we are conducting the examination for the 20 students, for all 20 students, we were evaluating in a different way. We were asking in a different questions. So all the 20 students will be evaluated in a different way. But what happens in the OSCE, here we give a particular scenario or situations to all 20 students, and same scenario will be assessed for all the 20 students and the evaluation will be same. So here there is no discrimination and the equally we can evaluate all 20 students on a particular topic or in a particular scenario or in a particular situation wise. So definitely we can consider this is one of an excellent method of evaluation, especially at the time of practical examination. When we come to the second strength is come to the validity as well as the reliability. See, as we seen in the earlier presentation that we need to prepare a structured questionnaire or we need to prepare a checklist, and even we need to prepare instructions for the students. But after the preparation of all those things, that we need to be validated by this particular faculty or the senior faculties or any other professionals. Why I am telling this one? Because when we prepare a particular checklist for a particular procedures, that may looks good for us, but when we submit it to the different professionals, that means in our nursing field only, if we submit to the other senior professionals, they may give a good inputs to us. With that, we can prepare a valid instructions or even valid questionnaires for a particular scenario. So that can be done by the particular department or by the college or even by the institutions. Next, after confirming that with the other professionals or even with the same professionals, we can test that one by implementing on particular group of people or particular group of students, whether it is reliable or whether it is a sufficient or whether it is understandable by the students. With all those intentions, if we implement that one on a group of students, that is what we can say. We can say it as a pilot study. We can do the pilot study on a simple group of students, and we can evaluate and we can find out what we made that questions or the checklist is right or wrong, whether it is acceptable to that particular scenario, and the particular answers will be come out from the students or not, that we can easily evaluate. So in another way, before we prepare any OSCE checklist or any questionnaires or any instructions, that need to be validated by the senior nursing professionals, and that need to be implemented on a particular group of students and evaluate whether it is a level or not, then we need to implement on our college. So that's the best way to implement this one. Next one is the third strength of this OSCE is the predetermined evaluation manual, of course. So here, the students will be sent to the particular station and he will be instructed to perform a particular actions or the procedures in a particular station, and that procedure or that scenario only will be evaluated. So to evaluate that scenario or that particular procedure, we need to have a predetermined evaluation pattern, so that it will be easy for the examiner and even for the students come to know that what the examiner is evaluating me, and even examiner will be very much clear what he is evaluating from the students and what he is expecting from the students. So with this, even we can make an effective evaluation about the students' clinical performances. And of course, definitely, um, the OSCE is have very much greater objectivity and lesser subjectivity. It again depends on the examiners. Why I'm telling this one? Because whenever you prepare an OSCE stations in your college, first you people decide how many stations you are going to prepare, whether it is a 3 stations or 5 stations, or even you may go for the 8 or above that one. It is all depends on the particular college or the institutions. The most important aspect is that here, when we prepare stations and when we decide the particular scenario in that station, for that station or for that scenario, we need to develop a well-defined checklist, because that shows or that gives whether subjectivity will be less or objectivity will be more. So that all depends again on the checklist what you have prepared for the each stations. With that, definitely we can achieve a greater objectivity and lesser subjectivity. So earlier what we were doing, instead of particular disease, so we were asking the overall. Suppose if I am asking the questions about the medical, surgical nursing, practical examinations. So I'm not focusing on one particular disease. There I was asking plenty of questions on different topics. But here it's different. Here what happens? Here we ask what is planned earlier and what is mentioned in that particular station and what to be performed by the students in that station. That alone will be evaluated by the examiner, so that here the subjectivity will be very much less and the greater objectivity we can see, so that the evaluation will be very much clear and transparent for both the examiner and even for the students. And come to the students aspect. Actually, in earlier days, we were taking the students to the hospital and we were allotting the cases to the students and we are evaluating the students' performances. But here what happens? Here, sometimes, in some conditions, as we mentioned, some stations they have man रखेंगे, some stations we keep unmanned. So suppose if we keep a man in that particular station and earlier scenario has prepared and will be given to that particular patient and he acted similarly as we planned earlier, so that the students will be easily learning that skill how to communicate with the students. That communication development is definitely will be improved in the OSCE stations, because see, when we collect the history from the patients or when we collect history from anybody, first there is certain procedures. That means we need to introduce ourselves, then we need to ask the student same response from the um, patient, and whatever the patient has given the response, in relation to that we are again giving the response and getting the collections, getting the information from the patients. So overall, by doing the OSCE, so definitely we can create a real situations in a particular lab and students will be learned that one, and the same he can perform in the hospital, so that students will be learned how to interact with the patient in a real scenario. That can be learned in the OSCE lab itself, in the OSCE situations itself. So that's why it gives very much reality as compared to the earlier method of evaluation. And definitely it improves the nurse patient communication. See, as I said earlier, so when we start or when we discuss with any patient before, first we should say that I am Lingaraj here, I am the nurse, registered nurse of this hospital, and this is my ID number. So I came here to interact with you and I just want to discuss some problems with you. Like that, we give an introduction with the patient, so that by understanding our position, by understanding our pre-planned information, the patient will give the equal responses. So there will be definitely improvements in the nurse as well as the patient and definitely the patient will give much more information to the nurse, and the nurse can gather large information, and definitely that will be very much useful for the planning the care for the nurse and even for the implementation of the care to the patients. And so, as I said, definitely OSCE will collaborate three important things. One is theoretical knowledge can be implemented in the clinical, and whatever the clinical implemented there, this clinical skills will be improved, and the meantime the communication is also improved. So in overall, if I take any nursing students, so what the student has learned in the classrooms, he will go to the particular OSCE lab, and there he will perform that procedure or he will perform that task, and after learning that one, again he will go to the hospital and he will do the same with the patient. So definitely the output of this communication or output of providing the care to the patients will definitely improved by the students, in the students. And critical OSCE is also will improve the critical thinking as well as the logical reasoning. So how it improves the critical thinking and logical reasoning? Even that is most important. See, as we see that we may create some 3 stations or 4 stations. In the first stations, what the student will do? Student will come to the OSCE lab and he will come to the first station and he will read all the instructions, and he will come to know, okay, these are my instructions. After going to the next station, what to be done? So he will plan, he will sit and plan in the first station. Next, he go to the second station and he will read the instructions in that particular station, and he will think or he will decide, okay, this procedure I have to perform. Okay, then he will perform the procedures. After that, again he go to the third stage. There, after performing the procedure, he has to record whatever he has done, and whatever he has to be reported to the higher authority. So that and all he will be report. Next, he will go to the fourth stage or the fourth station. There he may plan for the health education, or he may plan any performance of procedures. Then in the fifth station, then the same patient will be there, and for that patient he will perform the actions. So like that, there is a connection between one stage to another stage or one station to another stage. So there will be logically connected each and every procedures performed by the students, so that the critical thinking of the students definitely will improve, and even the logically the students will think, okay, so this first is the first I have to collect the history from the patient, then I have to diagnose the problem, then third one is I have to plan what to be implement the care or what the care to be performed, then in the fourth stage he will perform the procedure, and in the fifth stage he will evaluate that um, procedure, so that there will be connection between one station to another station, and definitely will improve the critical thinking as well as the logical reasoning. So the OSCE is not only is one method of evaluation of a procedure from the students, it is also one of the method of learning the clinical skills by the nursing students. So don't think that we are just creating this OSCE stations only for the evaluation purpose. No, not like that. Even after the completion of theory, when we take to the lab, in the lab itself, that means in the lab hours itself, we can make the students to do the OSCE procedures. So do the learn, perform the procedures in an OSCE station, so that they will be very much clear and what to be done. Next one is definitely it improves the active participation of the students, because in each students the students will be performed different activities, and he will be very much active, and he will be thinking what to be done in the next and what he done in the previous. So there will be what holistic performances of the actions definitely will be done by the students. So definitely there is an active participation. And when we come to the overall OSCE, that definitely OSCE is one of the structured, plus it is one of the flexible and adaptable and controlled testing environment. Why I'm telling this one? Because structured means in each stations we have decided what to be done and how to be done, what to be evaluated and how to be evaluated. And it is definitely flexible. Why it is flexible? Because we can some procedures can be done with the 3 stations, some procedures can be done with the 5 stations or even more than that. And it is adaptable, means we can make changes with any of our stations. in the earlier procedures we have kept the 3 stations. In the next procedure we have made 5 stations, and again that stations can be manipulated, so that it is definitely an adoptable method of evaluation, and it is a completely controlled testing environment. Why I'm telling this controlled testing environment, because every station in every procedure what to be done is very much clear for the both the examiners and even for the students, so that they will be in a controlled way, they will be in the directed way, so that they will perform in that direction only. So there is no there is very much or very much less subjectivity and very much more objectivity and very much clear for both the examiner as well as for the students. And definitely it will improve the confidence for the students, because in the lab itself the students will learn how to communicate with the patients and how to evaluate the problems from the patients, and it will develop the confidence among the students, and easily they can go and perform in the hospital. So it's very much easy for even students also. And I repeat it, all the students will undertake the similar stations and are judged on the uniform criteria. So there is no discrimination between any students. All the students will be evaluated on a particular procedure, on a particular actions. So there will be no discrimination between any stations. And even with this, we can identify the abilities and disabilities. What is meant by that? Abilities means some students may be very good in communication, some students may be poor. And in other performances, some students may be very good in performing the skills, where some students may be poor in that. So such a type of drawbacks or such a type of positive things in our students, we can easily identify by looking at the scores of the students in that particular station. So easily we can identify the abilities as well as the disabilities among the students. And with this OSCE, we can assess the skills and even the attitudes that cannot be measured by the written examination, such as communication skills as well as the professionalism. See, in this there is a common factor is that students' skill as well as the attitude. See, attitude even most important, because if a student is positive towards the patient, definitely he will be very much uh, near to the patient when he is asking the questions. That means when he is evaluating the questions, when he is collecting the history from the patients, the attitude is very much important. So in the OSCE itself, if a student has learned how to communicate and how to take out the answers from the patients, so definitely he will show a positive attitude towards the patient, and definitely he will give a very good care to the patients. And students can repeat applying of skills many times till mastering the skills. Definitely, students can perform these procedures repeatedly in the OSCE stations, and he will learn in a holistic way how to communicate and how to get the answers, and finally he definitely improve their skills. And of course, we are going to, the teacher is going to evaluate the students' performances. Meantime, the teacher can even teach the students how to talk with the patient, how to get an answer from the patient, how to perform the procedure to the patient, how to introduce the nurse to this patient before he perform any process. Like that, even the teacher can give a very good teaching in the OSCE station. So the students will learn how realistically he has to perform the OSCE. See, in the earlier days, we were just assigning the students to the particular patient, but here we are teaching this one in the earlier in the lab itself. We are assigning the students in the particular to the particular patient in the lab itself. We are teaching them how to communicate. The same he will be depicted in the hospital. So definitely it will be useful for teaching as well as for the assessment. Next one is realistic practices. So we have said that one station will keep go for the manned and one station we go for unmanned. Okay. Suppose if we go for manned, suppose if we keep a real patient or a real um, another person. So who is what he does? We will give the scenario. We will give the structure to that person earlier itself. So these are the answer you need to give, and when the nurse asks the questions, and these are the answers you need to give. So like that, if we give the scenario to the patient, in this NOSCI stations, so that students also will learn how to be tactfully we can answer to the patient's problems. These are some of the major strengths when we come to the OSCE. Now come to the weakness. So definitely in every aspects, in every method of evaluations or in every teaching methods, there will be positive things as well as the weakness also. So when we come to the weakness, here very much a few um, weakness are there, because this is definitely one of the most accepted method of evaluation and even the most accepted teaching method all over the world, which definitely improves the students' clinical skills um, when they are performing in the hospital as well as in the labs. So when we come to the weakness, OSCE it needs a complex planning and organization. Definitely, it needs a complex planning as well as organization, because we have in the nursing we have 5 different specialties. Each specialties have different procedure to be performed, and each procedures need to be planned, checklist, instructions, and the procedure to be planned. So that definitely it is a very much complex process of planning as well as the organization, and those instructions and those checklists need to be approved by the higher authorities, and even is shown to the higher nursing professionals so that they will validate and give to us. So to prepare a final well organized OSCE stations with a clear instructions and the checklist is definitely a complex process, and definitely it's a hard work to be done before we perform this OSCE. And come to the resources. So definitely when we come to the resources, it is bit expensive or even it is bit difficult for the college or the institutions, for the principals to organize this one, because certain stations demand very few articles. In such certain stations, um, that station may demand some expensive um, items or some expensive dummies, so that the college or some of the management may not be affordable. So since in some procedures or in some aspects it is bit difficult to organize, and especially with the resources. And as I said, maybe some places or in the some areas, sometimes we need a high cost or even the expensive articles, so that it's bit difficult to organize. And we said that manned and another one is unmanned. So manned, okay, fine. For the few students we can arrange, but to cover all the 50 students or 100 students by single patient, by a single person, sometimes it's very difficult. By the time there we need to go for a not real patient, means dummies we need to go. So sometimes we perform the same procedures on the dummy. Sometimes it may not be a real, but the students will definitely learn the skills, but realistic will be some places in some stations maybe need to be compromised. And so as Indian Nursing Council has said that in the 8th semester that all 5 specialties procedures to be evaluated in the OSCE stations, and all 5 specialty examiners to be present at the time of examination of final semester. So by the time definitely we need a large number of observers. So by that is maybe one drawback to organize large number of observers and evaluate all the students. That may be tough or some difficult. Let's see what the university decides in the future. We'll see. And sometimes definitely this is time consuming. So within a day we may not able to complete all 20 students. There need to be compromise, or there need some time will be extended more than 5 o'clock. So it is all depends on the how OSCE stations what we designed, and what the instructions what we prepared, and even the checklist what we prepared. That all depends on the stations and the instructions papers and the checklist what we prepared. Based on that it will be decided. But some places it may be time consuming. If we well designed and well planned, organized properly, definitely we can save the time, and very much clearly we can evaluate the students' performances. And so this is completely a new method of evaluation and new method of teaching for the students and even for the teachers, because many of the teachers are finished their BSc nursing or the PBBs or MSc nursing with the regular examination patterns, and it may be and it is completely new for them. For that, definitely we need to give an intensive training for them, even for the teachers also, and even for the students, so that if the teachers are well equipped and skilled and come to know how to organize this one in a very much way, very much good way, so definitely in the future we can implement a well OSCE methods of evaluations. So with these um, strengths and weakness, I'm very much grateful to all the teaching faculties and even for the students for attending this program. Thank you so much for attending. Thank you.
Thank you, sir. The session is open for discussion. Participants, if you have any queries or any doubts, you can ask.
Speaker on करो.
Participants, if you have any doubts or queries, you can ask.
ये स्पीकर ऑन करो. माइक बंद है, स्क्रीन बंद है.
Participants, if you have any queries and doubts.
Madhura is good. Madhura is good. network के लिए लोग.
I think there are no any questions. Thank you, sir, for your valuable contribution to our program. Your expertise has undoubtedly left a lasting impact on our understanding of OSCE, and we are grateful for the guidance you provide. Now we are at final phase of CPD program. Before we proceed, on behalf of MS College of Nursing, I would like to express our gratitude to all the speakers, participants, esteemed faculty, and organizers for their relentless efforts in making this event a success. Today, we are honored to have with us a distinguished personality as a speaker for valedictory function who has dedicated her life to the field of nursing, education, and research. I would like to invite Dr. Meera Ganpate ma'am, a trailblazer in the world of nursing and healthcare. Ma'am is currently serving as a professor cum principal at Maharashtra Stree Shikshan Samstha, Srimati Bakul Tambad Institute of Nursing Education, Pune. Ma'am's educational journey includes earning a BSc in nursing, followed by an MSc in nursing, where she achieved the prestigious title of gold medalist. Further, solidifying her commitment to the field, she earned a PhD in nursing from her Bharati Vidyapit College of Nursing, Pune, once again securing the gold medal. Ma'am's dedication to nursing education is evident in her various roles from the clinical instructor to principal, shaping the next generation of nursing professionals. Her extensive list of achievements includes several awards and recognitions. Ma'am is not just an administrator, but she is an accomplished researcher with numerous publications and articles in prestigious journals. Beyond her professional accomplishment, Ma'am is known for her ethical contributions, serving on ethical committees, board of studies, and as a mentor and guide for the countless students and aspiring researchers. Today, we are fortunate to have Ma'am here to share a wealth of knowledge and experience with us. I request Ma'am to initiate the valedictory function by sharing your valuable insight and thoughts with us.
to work together, and in a conventional method we used to delegate certain units to teachers, and that teacher would prepare lectures and deliver it, and then we demonstrate some procedures in the simulation lab or in the nursing arts lab, then take the students to the hospital and then make them work with the patients directly. Whereas in this OSCE method, you have your conventional lecture and lecture method followed by an OSCE which is set for each unit in the college, in the simulation lab, where the team of the whole department, say foundation department or medical surgical department, get together to plan for their stations. So by doing this, all the teachers will become efficient in making OSCE stations. And unless you use it for each and every unit, it will become very difficult to implement it on the day of examination, both for the teacher as a faculty and for the students as a examinee. So I would request all the colleges, you see to that your departments, your departmental members, faculty work together, and for possible units, whichever units, like for example, physical examination in foundation of nursing, or vital signs, or could be parental administration. Major units you identify and start making OSCE plans right from the beginning, delegating each and every departmental members a particular station, so that they will also become an expert to setting up the stations. Unless we do that, one fine day just taking them to the clinical area or taking them to the examination hall or in the patient units in the hospital, this hospital will not be easy. So slow and steady progress, which is guided by the principal and supervised by the departmental head, where all the unit members of each and every nursing department work together, and then if they implement this OSCE, it will become fruitful for the students, and students will be able to appreciate, because this includes many more domains of or many more domains of learning, that is, as Benjamin Bloom talked about, levels of domains of cognitive or psychomotor affective, different higher levels of domains are involved in this. So this is going to be an exceptionally excellent method of teaching both theory and mainly practical skill to the students. And all the three speakers did an excellent job of getting the concepts very clear to all of us. So that means I'm sure they have put up a lot of efforts to understanding this concept themselves, and then they made it very simple for all of us to understand. So credit goes to Pradesh Jangam and Professor Tejaswini Kalekar and Professor Lingaraj for taking time and preparing excellent presentation under the guidance of principal. And for all the members who attended, take home messages, please start implementing OSCE without getting scared in major units during your semester system or annual system, so that students are exposed to 3 to 4 OSCE sessions, then implement it in your internal examination, then go to external examination. Unless you do it repeatedly, it will become difficult for both of us to do it on the final external examination. And if we do it consistently, even the exit examination, which has 5 faculty coming for examination in the 8th semester, will become easy for all our students. And I would request MES Society, MES College of Nursing, that is Dr. Milind, to share the PPT, which is prepared well. If you don't have any issue with sharing, please kindly share it with all the members. It will be useful for them to use it in their college. And once again, Thanks to your team and all the faculty for taking time, and your comparer and students who made the program smooth in terms of comparing it. So thanks to each and every one of you, and from our association, we are really happy to take forward this CAB once again. Thank you all. And I think there are some queries from the audience, and please feel free to discuss.
Sure.
Definitely, you will get your another turn.